we're back in, well, I've actually never joined this game before. Wait, no, I have played this game before. It's just, I've never recorded it. Anyway, I'm gonna show you how to work everything in the NPC update. This is not, I don't think this is a very new update. I just didn't know until today, and I got everything. I figured out how everything works. So I think to do this, you need to be a nurse, medic, doctor, surgeon, or I think that's all you can be. So I'm just gonna be a doctor, but it doesn't matter which one you pick. So first, if you're in a private server, if you want somebody specific, you're gonna have to check in a lot of people. But yeah, I'll show you maybe most of the rules. I actually don't know all of them, but I'll show some. I always get confused where to go. Like, somehow okay. So let's see if we have anyone waiting already. Okay, so this is Jasmine V. Claim patient. You're on it today. Okay, come on, Jasmine. I need a wheelchair. Hold on. Can you get him from here? Yes, you can. Sorry, I've been playing this game a while. Anyway, so, I keep clicking that button for some reason. You're just gonna take the patient to this is how you see the task. It might say ER room, and if it's, like, you know, labor delivery room, or yeah, you know what I mean. So you'll see the patient. I think I'll just take this patient to a regular room, maybe number 2. Go sit on your bed. Then you're gonna grab a patient gown. These can be located in shelves around the room and in supply closets, which can be located in these little, like, desks. These tiny ones, not the front one. And then we're also, hold on, I'll show you that later. Sorry. Sometimes they show gloves in here, which we are gonna need later. So, yeah. But usually they should be in the, I like to grab a mask, even though I don't need them. I don't know how to grab a mask. Why am I just keep yapping? I need a patient's gown. Let's give this to our patient. Remember what room your patient's in, because that will be important. You're going to be running around a lot. We're going to take the temperature. Actually, you don't have to get the things out. Yeah. But I think you do need to get the cards. Pretty sure. Yes. You have to go get the vitals cards. Excuse me. Wait, what is that? I like to grab a mask just because. These can be found all over the place. I honestly get very confused. So if you're in one of these rooms, you just turn, you go across from the room over to this way where you see this little one. You'll find it eventually. When you walk in, you'll see those rooms first. You just walk over here, and then you should see one here. We got this. Oh, I didn't mean to place it there. I'm saying the places of everything because I was very confused because all the videos I watched. Excuse me. Why is it not letting me get the cart? Okay. I'm saying the places with where everything are because I got very confused when I was looking at videos and they didn't say where the locations of everything was. So that's why I'm saying places of everything. This will take a minute. Just checking the heart rate. use computer to avoid sign. So you're gonna go out. And then if you're in the labor and delivery place, then you're gonna have to come out of there, because I don't think there's any desks in there. And then there's this middle desk here, and there's a middle desk here. You should be where you're at. If you're not upstairs or downstairs, you should be able to find one of these easily. So you just get on the computer, press sign in, then you check for stuff. Yeah, or his. Could be a boy or a girl. And then let's wait for the doctor to review her symptoms. You're just gonna wait maybe a minute or so. Maybe probably 15 seconds. Yeah. Let's put on gloves while we wait. Gloves, because you are gonna need gloves later. There should be gloves in here. Last time I looked. If I get confused of where something is while I'm gonna, okay, there we are. Gloves. Check the computer for treatments. Okay, swab sample. Okay, let's go to the supply room. Supply rooms, as I said, will be across here and just kind of around the map. Why did I say map? It's around the hospital, I guess. Test samples, test swabs. I don't know. Just grab one of these and then bring it back to your patient. Swab patient. Okay, you can press guide me. I did not know that before, but you can press guide me. I was very confused of where to find this. So this is the most important part. You just press guide me and it actually shows where it is, which is very useful if I actually paid attention when I was losing this. But it should be over here around one of these desk areas. This long tube thing, and then you put it, move capsule, then you press move capsules, and then press add item to capsule. Why did I say capsule so weird? Anyway. And then dispose of gloves and trash bin. Trash bin's right here. Boop. Then we're gonna wash our hands. Easy. Just click on one of the sinks, which can be located over here where I am. Wait for the lab to receive your sample. And then if you get this message, your patient has triggered their call light, go check on them. Just go to their room and see what they want. And then they'll say they want something. So if it's a food item, this one, in my case, is coffee. But sometimes they'll request something from in the supply room, in the mini fridge, or yeah. But coffee, I actually don't know where the coffee is. This is awkward. I've seen the coffee, there we are. This will just be around the corner from one of these. We're just gonna grab some coffee for our patient. Okay. I don't know what our patient's issue is because I didn't check her in. I just spawned in and she was there, so. Give coffee. Okay, this is our pager, just press accept. Okay, we gotta wait for a doctor to diagnose the patient before continuing treatment. So, we just gotta wait a second. Waiting. The baby's laughing. It's so cute. Anyway. Okay, let's check the computer. Again, the computers are over here on one of these small desks. Should be by these rooms. Or the exit rooms and stuff like that. So it says, I'm just gonna read it, and then, well, I guess fungal infection. Not poisonous, not none of these. So she diagnosed already, so okay, what do we need to do now? Go to Quick Seizure medication to the antifungal. Okay, so these can be anywhere. So you kind of just have to look. It's not in a specific spot, really. So you just, oh, there we go. I found this next to, it's right across from the ultrasound room. So 107. So just go over here and it'll say what you need here. And it says antifungal, so let's just find that. That's what we need. Boop. Dispense. Give the patient. I try to be as quick as I can, but sometimes they leave you if you take too long. Yes, I know, because I'm slow. Yes. Then we'll grab the non-stick bandage. I don't know why they have to add the non-stick part, but okay. Okay, let's let the patient rest. This will just take a little bit. Yeah, it's kind of boring. You just gotta wait. And then I think after that, you'll be able to discharge him. Oh. Triggered the light. What do they want now? Let me guess, they want crackers. Oh, they want to go home. Okay, so first we gotta go to one of those printers. There should be one on these tiny desks again. You'll just find it right over here. This thing, next garbage can. And press discharge papers. Sometimes they're different, so I'm just gonna do another patient, just in case they're different in something else. I'm also gonna show you how to check in patients, because some people don't know that. Oh, sorry. Okay, here you go, Jasmine. Here's your discharge papers. Okay, filing boxes. There we go. Actually, I learned how to do this all this morning. Okay. Bye, Jasmine. See you later. Let's go to the reception. Oops. You can do the reception as any role. Except for, I think you can't do it as patients or residents or stuff like that. Let's look for someone with a different thing. Let's try him. I'll see what he has. Okay, so they're gonna be different. We'll see what they want. Liam F. Let's put you in the wheelchair. ER room. The ER can be located. You can actually do any room, I think. When I tried, I just did the pediatric what ER thing, this one, and it worked. So this is what I'm gonna be using. Or if you find the ER, then okay. What does he want? Rescued from cardiac arrest. Suspected dehydration. Pain status. Confused and angry. Okay. So let's see what they want. We need a gown, which is over here on these tiny desks. I think this one doesn't have it. You go all the way to this other one that has a supply room, or any supply room has them. I think they have a little shelf somewhere with the gowns. Pretty sure. I don't know exactly where it is, but just saying. Oh, right here. Patient gowns are right here. let's go give it to our patient and memorize where your patient is sitting. Let's give patient down. We're gonna check their temperature, do all this stuff, which is for every patient. It kind of gets repetitive, to be honest, but I'm just doing this for people who don't know. So I know I was so confused the first time I tried this. Yeah, I couldn't find anything. Nothing. Because for real players, you don't have to do all this extra stuff. So, yep. Because they don't have actual like needs, kind of like these. Why can I not find a cart? There's a cart. Cart, Miles cart. Excuse me. Give me. Why does it keep doing that? Give me the vitals chart. Oh, why does it keep doing that? I swear. I'm gonna cry right now. Okay. Use. Okay, let's get to the computers. Where it can be located. You guess what? Tiny desks. Sorry. And after this, we're going to. I'm just gonna show you how to do. Check in someone, which is pretty easy. I figured it out on my first try, but if you can't figure it out, then yeah. First, we're gonna go to supply room, and you guessed it, or well, I guess we're gonna get the Salient IV. Wait. Oh God, do not go to the supply room. I was mistaken for something else. We're actually gonna go back in here. We're gonna connect this one. I'm sorry. I was mistaken with something else. Oxygen mask. Then we're gonna give a water cup. Union. You can locate water cups in supply rooms. Most supply rooms. I think you can find mini fridges around here, I think. But wait, no. It's not in the mini fridge. Why do I keep messing up? They should be around here somewhere. They're right around the corner from these things, the little mini desks. And we're gonna grab a water cup. And then let's go back to our patients. How can he drink the water with the oxygen mask on? This is Roblox, not real life. So, okay, let's just wait a second. The video's coming to an end, but yeah. Okay. Sorry, I was not talking. Fine. I was just waiting. I don't know why. I was like, what's the word? Dude, what was the word? What is the word? Dude, I don't know what the word is. I was rehearsing my outro. Yeah. Okay. Blood sample from the supply room. Supply room, you guessed it. Over here. Blood sample. Actually, never done one of these before. Blood sample right here. And then put gloves on. There should be some in his room. If I find one on the way, then yep, right here. Glove. Trigger warning. Tip system. Oh my god, why am I slowly crashing out? I've actually never done a voiced long form video. I tried to voice my first one, that toddler tutorial, but I didn't know how to turn on the microphone. So guess what? Yeah. Ignore that. Oh, why am I literally crashing? Bye bye. Okay, suppose. Wash hands. You know the drill. Thanks. Wait for the lab to receive your sample. Okay. Okay. So you're just gonna go to the patient's room and see what they want. My guess he wants orange juice. I always guess for some reason. Hello. Oh, he wants coffee. Which is over here. Where it always is. Coffee. There we go. Let's just let the patient rest. Disconnect the stuff from him. Liam. Okay. Print out discharge papers from a printer. I don't know if I could send. Maybe. Okay. It just gets repetitive. And then after this patient, I'm just gonna show you how to check them in. So yeah. Stop it. Okay. Brown box. Put that in the brown box. And then we're just gonna send this patient home. I hope I thoroughly described where everything is. If you have questions, just leave them in the comments. I will answer as soon as I can. I promise. Even 2 years from now, I'll answer questions. Okay. Where am I? Okay. Now, I'm just going to show you how to check in a patient. And then this will be quick. So let's do her. Let's just click what you want to say. And then they'll ask a few questions. Let's just say, alright, what's your name? You can say whatever you feel like it. I don't care. It's just... I just try to be as nice as I can. Okay, that's how you do it. So that's the end of the video. Again, if you have any questions, please leave them in the comments. I will answer as soon as possible, or maybe respond with a video. Who knows? If you have any video ideas or anything, please put them in the comments. I definitely need ideas. I am gonna do Q&A soon, so you can ask some questions if you want. But I'll also post a short asking for questions. Ooh, I got a new level. And anyway, ask questions if you want to. And then, yeah, I think that is it. If you ask personal questions, I probably won't answer, because, yeah. So, I think that's it. Bye. What? Why did I say bye so weird? Okay. Okay, bye.